Our bodies are just incredible, aren't they? That whole framework that holds us up, our musculoskeletal system, it's basically a companion we have for our entire lives. It's there for every single step, every box we lift, every time we jump for joy. But, like any lifelong partnership, it changes over time. So let's dive into this journey and really understand the story our bodies are telling us as we age.
Now, this image might look a little technical, but really, it's the universal blueprint of the subtle shifts that happen inside all of us. We're talking about bones getting a bit more brittle, maybe our spine shortening just a tiny bit. These changes aren't about decline, not at all. Think of them as the natural, physical record of a life that's been fully lived.
All right, so here's our roadmap for this explainer. We're going to start with the basic changes to our body's framework. Then, we'll zoom in on a couple of really common issues: back pain and osteoporosis. After that, we'll look at how doctors figure this stuff out and manage it. And we'll wrap up with some powerful ways we can all build a stronger future for ourselves. Sound good?
So first up, our aging framework. Let's start with the basics. And I want you to try thinking of these changes less as problems and more as, signs of experience. It's just the natural wear and tear on the structure that's been supporting you for decades. So what's actually happening to our bones? Well, over time, they naturally become a little stiffer, maybe a bit weaker and more brittle. Their density and calcium levels start to dip. A big one is that the discs between our vertebrae can thin out, causing the spine to shorten. This can actually lead to a noticeable drop in height, sometimes up to 2 inches. And it's what can contribute to that stooped posture you might see, a condition called kyphosis.
And it's not just our bones, our muscles change too. The actual number and size of our muscle fibers can decrease, which might make our movements feel a bit slower. This natural age-related muscle loss has a name: sarcopenia. And you know what really speeds it up? Inactivity. That's exactly why staying active is so incredibly important at every single stage of life.
And just to put that into perspective for you, check out this number. By age 80, a person can lose between 30 to 50% of their muscle mass. I mean, think about that. That could be almost half. It's a huge range, and it really just hammers home why taking care of our muscles isn't just a good idea. It is absolutely essential for keeping our strength and our independence.
And finally, let's talk about our joints. The connectors, right? The cartilage that cushions them gets thinner from all that wear and tear over the years. At the same time, our ligaments and tendons, they just lose some of their stretchiness. So what's the result? Well, joints can feel tighter, a bit stiff, our range of motion might not be what it used to be, and tissues can get injured more easily. It's really just the body's way of saying, hey, let's be a little more mindful with our movements.
Okay, let's shift gears a bit. We're going to talk about something that so many people experience: back pain. It's so common that it almost feels like an unavoidable part of getting older, but really, understanding it is the absolute first step toward managing it.
So, why the lower back specifically? Just think about the job it has to do. That area, the lumbar region, is both super flexible and it's responsible for carrying most of our body's weight. That is a tough combo. So it's really no surprise that lower back pain is a leading cause of disability across the globe and one of the top reasons people go to the doctor or have to miss a day of work.
It's also really important to know what kind of pain we're dealing with. Acute pain is the short-term stuff, usually lasting 4 weeks or less. It's often tied to something specific. You lifted a box that was way too heavy or maybe just overdid it in the yard. Chronic pain, on the other hand, is the kind that sticks around for more than 3 months. It's often progressive and it can come and go in episodes. Telling these two apart is absolutely key for getting the right diagnosis and treatment.
And here's the thing to realize. A lot of these risk factors are things we can actually do something about. Stuff like carrying extra weight, having poor posture, or not having great muscle tone. All of that puts extra strain on the back. Even stress can play a part. And of course, jobs that make you do a lot of heavy lifting, or on the flip side, a lot of sitting for hours on end, those are major culprits too.
All right, on to our third topic: osteoporosis. People often call this the silent thief, and for good reason. It can sneak up on you for years without a single symptom, quietly stealing bone mass until, bam, a sudden fracture reveals the whole problem.
So what exactly is it? Well, osteoporosis is a disease where your bone mass goes down and the actual structure of the bones starts to break down. This is what makes bones become porous, brittle, and so fragile that they can break from something as simple as a minor fall or even just a powerful sneeze.
Let's take a look at what's going on inside the bone itself. See, your bones are constantly remodeling. I like to think of it like a never-ending construction project. You've got these cells called osteoclasts. They're the demolition crew, clearing out old bone. And then you have osteoblasts. They're the builders, laying down new bone. In healthy bones, this crew works in perfect balance. But with osteoporosis, the demolition team starts working way faster than the builders can keep up. This leads to a net loss of bone, and that's what makes them weaker over time.
So what throws this balance off? As this chart shows, it's a whole mix of things. Some of it you can't control, like your genetics or just getting older. But there's a lot you can influence. Take nutrition, for example. Not getting enough calcium is a big risk factor. And in terms of lifestyle, things like smoking or not doing enough weight-bearing exercise can definitely contribute. It's a really complex puzzle with lots of different pieces.
Okay, so we've got a handle on the problems. But here's the good news. We have some really effective ways to diagnose and manage them. Let's talk about how we can actually reinforce our body structure.
For back pain, a diagnosis usually starts with a simple physical exam. For osteoporosis, the gold standard is something called a DEXA scan. It's a special kind of X-ray that measures bone density with incredible precision. Best part? It's a quick, painless test that tells doctors exactly how strong your bones are.
And when it comes to managing back pain, there is a whole toolbox of options. We're talking about medications like anti-inflammatories and, of course, physical therapy that focuses on stretching and strengthening. Then for the really severe cases, surgical options might be on the table, things like a spinal fusion or a laminectomy, which is where a surgeon removes a tiny piece of bone to relieve pressure on the nerves.
And that brings us to the final and honestly, the most empowering part of this whole discussion. All this knowledge is pretty useless if we don't act on it. So let's talk about how you can actually take control and start building a stronger future for your musculoskeletal system, starting right now.
You know, it's small, consistent actions that make a massive difference. Regular weight-bearing exercise literally tells your bones to stay strong. Getting enough calcium and vitamin D gives them the building blocks they need to do it. And simple daily habits like focusing on good posture, lifting with your legs instead of your back, and sleeping on a firm mattress can take so much strain off your back. These are all practical things you can start doing today. So in the end, the changes in our bones, our muscles, our joints, they really are just part of our life story. They show where we've been. But the most fantastic part is that we have a huge say in how the next chapter gets written. By understanding what's going on and by taking these proactive steps, we can make sure our lifelong companion, our body, stays as strong and supportive as it can be for years and years to come.